One thing that social media has done is it has romanticized nursing. From the dancing TikTokers to the trendy reels. So why are people leaving? What is going on?
We have a nursing shortage so severe, it threatens patient safety and access to care.
Wage inflation has affected us, and those higher costs is really what is forcing people in our industry to close their doors.
More Americans across the country are struggling to find physicians.
As of 2026, the U.S. is facing a shortage of more than 96,000 physicians. And when it comes to nursing, the gap is even wider, with a shortage of roughly 260,000 vacancies. And on top of that shortage, hospitals are facing a brutal reality. They're packed with patients, but they are losing massive amounts of money on labor costs only. Hospitals are stuck in a cycle where they must pay premium rates for even temporary staff, which is crushing their ability to heal and their profit margins. Hiring more people is not the fix. Many hospitals are struggling with the national nurse turnover rate and a $60,000 price tag to train new nurses. The pressure on this workforce is only going to intensify because of a massive demographic shift, the silver tsunami, the senior surge. There's a lot of names for it, and it is increasingly in headlines as a major economic shift.
A silver tsunami
is what real estate experts call the silver tsunami.
We all keep hearing about the silver tsunami, but what is it?
In 2026, the oldest members of the baby boomer generation are turning 80, marking the beginning of a massive wave of healthcare demand. By 2040, the population of Americans aged 85 and up is going to more than double. Considering this, hospitals need to help the surgeons and nurses get more done in less time, slash patient recovery windows, and keep beds open. And that brings us to Intuitive Surgical, the Apple of the operating room.
When I think about transformation, I think about Da Vinci 5.
For me, as an administrator in surgery, I focus on better and safer surgery, and I think this technology is a huge leap forward.
After a massive 2025 where revenue jumped over 20% to over $10 billion, they are targeting 13 to 15% growth in 2026. Think of their business like a subscription. Once a hospital buys a new Da Vinci 5 robot, they're locked in for years of training, service, and specialized parts. Their recent FDA clearance for heart procedures is a big deal. It moves them into high-value complex surgeries like heart valve repair. With over 3 million surgeries performed annually, they have a mountain of data that helps them refine their tech in ways competitors can't easily copy. But while Intuitive builds the high-tech tools, HCA Healthcare is the one proving the model works at a massive scale. As the largest for-profit hospital system in the US, HCA is projecting up to $80 billion in revenue for 2026. They are backing that up with a $5.5 billion budget specifically to buy this new type of tech. They are the essential business-to-business player. They buy the robots and use AI to make sure their hospitals stay profitable even with these high labor costs. They aren't just buying machines, they're buying the ability to handle more patients efficiently. Finally, the shift is big enough for real challengers. Medtronic hasn't officially joined the fight with their Hugo robotics system, recently clearing FDA hurdles and completing its first US commercial cases at major institutions like the Cleveland Clinic.
Status quo is shifting. The possibilities are expanding. The excitement is growing. Then it arrives.
Unlike the rigid, massive footprints of traditional systems, Hugo offers a modular mobile design, meaning hospitals can move the robot from one operating room to another operating room, which is a game changer for hospitals fighting over scheduling space. Medtronic is leveraging its massive existing global footprint by integrating Hugo with their Touch Surgery Enterprise AI to provide surgeons with real-time feedback. With the surgical robotics market expected to hit $13.5 billion this year, Medtronic isn't trying to outrun the leader by any means. They're betting that hospitals want choice and flexibility over a single monopoly like Intuitive possibly. Finally, if we're talking about the total hospital overhaul, we have to talk about Stryker.
Because when tools work better, people are at their best. Care transforms, new standards emerge, and lives are impacted.
While Intuitive handles the soft tissue and Medtronic plays the flexible challenger role, Stryker dominates the world of bone and joint repair. Their Mako smart robotics platform is the industry standard for total knee and hip replacements. And think about the scale to all this. The US population is aging, and the demand for joint surgery is skyrocketing. Stryker's advantage is that they don't just sell the robot, they own the entire workflow. Subscribe to Ringo Insights for more quick takes.